Hi, I'm Maxine Dexter, Congresswoman from Oregon's 3rd Congressional District. You've probably heard that the federal government is shut down. So what does that actually mean? I'm here to break down what it means, how we got here, and how we get out. Okay, so let's start with the basics. Every year, Congress is responsible for passing appropriations bills that fund everything from services for our veterans to national park services to federal employees' paychecks. Funding the government is one of Congress's most important jobs to make sure your tax dollars are spent on the government services that you and your family rely on. These appropriation bills are supposed to pass and be signed into law by October 1st each year. But if Congress doesn't get them done in time, we can pass what's called a continuing resolution, a CR, basically a short-term fix to keep the government open for a designated period of time. But when Congress fails, and we are clearly failing, to pass either of those, that's what we call a funding gap, and it triggers a government shutdown. A shutdown doesn't just mean political gridlock. It means longer wait times for critical services offered by the Social Security Administration. It means federal employees missing paychecks. It means small businesses having a harder time getting federal loans. And it means disruptions that ripple across our economy. We've already seen thousands of flights delayed or canceled because TSA staffing has been stretched thin. So how did we get here? Well, let's just start with the fact that Republicans control the House, the Senate, and the White House. It is their job to govern, to fund the government. But when they need to work with at least 7 Democrats in the Senate to pass anything, they have to do it in a bipartisan way. And instead of negotiating with Democrats, they walked away, literally. They asked Democrats to rubber stamp a bill that does nothing to fix the healthcare crisis they created. And we said no. Republicans have spent the past year dismantling our healthcare system. And if Republicans want us to vote with them, they're going to need to reverse course. Democrats are in Washington ready to negotiate a government funding bill that protects healthcare, lowers costs, and includes an ironclad agreement that reins in Trump's abuses. At the center of this healthcare debate are the Affordable Care Act tax credits, the tax credits that help working families across the country afford their health insurance premiums. If Republicans fail to act, those credits will expire this year. That means more than 20 million people will see their premiums double overnight. And the consequences won't stop there. As a physician, I can tell you, when people can't afford insurance, they forgo coverage altogether. But that doesn't mean they stop getting sick. It means preventable diseases become crises. People show up sicker, and the cost to care for them rises. That is what this funding fight is about. All we are asking for is this. If Republicans need our vote, and they do, then they need to do something to address the healthcare crisis they created. And we must fight for that agreement to include ironclad protections that prevent Trump and Republicans from backtracking. The stakes are too high to do anything else. Trump has a proven track record of abusing his authority. He's doing it right now in Portland, where he's trying to send militarized forces into our community. Any agreement we reach must ensure he can't just tear it up or twist it for political gain. We need to protect Americans' healthcare. We need to lower costs, and we need a government that actually works for the people it serves. So how do we get out of this shutdown? The answer's simple. Republicans need to come back to Washington, sit down with Democrats, and negotiate a deal. I'm here. We're ready. And while I hold the line for your health care, I also want you to know that my office remains open and fully operational during the government shutdown. My staff has been deemed essential and are here to help you. We know this is hard. We've developed a list of frequently asked questions and resources on my website, and my team of bilingual caseworkers are available to help you access federal benefits. We'll get through this together, but I need to keep hearing from you. So please continue reaching out to my office, especially if you're seeing your healthcare costs rise or you can't get the services you need. Oregonians sent me to Washington to fight for them. And that's exactly what I'm doing. Stay loud, stay engaged.